At Dentist Job Connect, our goal is to bond associates and owners together to share in the joy of dentisting, which I describe, Dr. Nacho Goodman, as full contact arts and crafts on patients who do not want to be there or pay for it. Us dentists need to stick together to help patients, and I am here today with one of my favorite people in this dentisting world who will introduce himself in just a second. But to connect with us and learn more about this position and others, text HIRE to 215-798-9897 or reach out to us at dentistjobconnect.com. So I know a lot of people in this dentisting world know you, but share with us who you are and what you do on a day-to-day basis to make not only patients, but other people smile.
Yeah, my name is Ben Kacos. I own Shreveport Dental Solutions, and I'm Dr. Nacho's favorite topping. He loves to spend time with me. It makes his life tastier.
Yeah, that is true.
Yeah, man, we're down here in Shreveport. Today's a big day. One of my favorite words is harge. Are you familiar with that word?
I don't know. Tell me. I'd like to know.
It means gut feeling. Yeah, we're all about gut feelings here. We're always striving to create the best gut feeling with our patients and with our team so that they know as soon as they walk through the doors, they're in the right place. So today, we're doing a little spring cleaning and having our floors waxed. I've got this crew that comes in twice a year, and they make the floor look like a skating rink. It's unbelievable. Keep this office so clean. So I'm outside for this Zoom.
I think, Ben, people don't realize, and even though I grew up in a dental practice with my amazing dad, sadly he passed away, but I grew up doing all the jobs and owning a practice, just how many human beings get processed through a dental practice in a day between hygiene and emergencies and your schedule. You have 60, 70, 80 people going through that in your office, maybe even more. We can talk about that. But I think I didn't really realize that just the number of people that come through and keeping your office looking clean is not an easy job all the time.
Dude, I just saw how many toothbrushes and little 2-ounce things of toothpaste that we have to process for our hygiene department. They need their own freaking storage unit, man. It's crazy.
Yeah. Well, we're talking here today. You have utilized Dentist Job Connect to find an associate, and you're out there looking for another associate dentist. If an associate dentist was watching this now, just kind of give us a little background on your dental team. Who is it now, and who are you looking to add?
Yeah, man, we've got a 5-star team, highest rated office in Shreveport, Louisiana. And we've got 2 associates. One of them, Dr. Patel, number 1, is celebrating his 4th anniversary. Dude came to me straight out of school. He's learned molar endo, cosmetics, Invisalign, implants, surgery, IV sedation. He produced $1.7 million in the trailing 12 months. How about that?
Let's pause on that for a second, or I would say I want to interject, because later today I'm doing a webinar on dentists who consistently produce over $100,000 a month. What do they do to make that happen? And you have an associate who's consistently producing over $100,000 a month. So to use a Jason Tenori term, unpack that for us a little. Tell us just a little bit about this associate who did 1.7 million. What type of procedures are they doing? How did you mentor them to do that? Both of you should be proud of yourself. So I'd like to take a minute and learn a little more about those details.
You bet. It's a testament to our training, and it's a testament to this fine individual in the power of implementation, right? So he is what we call coachable. There's 2 qualities that we say it takes to be successful in our organization: coachability and culture fit. Coachability is the ability to take the information that somebody has bestowed upon you and implement it, okay? And then culture fit is doing whatever it takes to win at the end of the day. We all row the boat in the same direction. And so, he has learned communication, how to build rapport, how to seal the deal on big cases in 2 minutes, how to walk into a room and meet somebody for the first time, and they have that gut feeling that this is the right man to invest $20,000 in my mouth with, right? Awesome. And then we've got the back end team that seals it up with the financing options and the insurance and all that, So, like, look, we have patients in this practice that they finance single tooth extractions, and we have patients that pay cash for full mouth rehabs. We see everybody. What we focus on doing is getting a yes out of everybody that walks through this practice, whether it's a single tooth extraction or the case I did yesterday, which was IV sedation, crown and bridge, roundhouse work on a young lady. So that's what got him there: communication, learning the clinical skills, and implementation.
I love that, Ben. I mean, it's my Zoom webinar. I can brag about whoever I want. So you are a DSI black belt coach. I'm a member of DSI, but your story, we know each other well. You didn't start out as the LeBron James of dentistry, right? You didn't start out as, I use a Philly term, Jalen Hurts of dentistry. You grew into this role, and now you're coaching other dentists. So what value do your associates get being in the same building as you, because you've been through it all and now you're coaching them? Tell us what this DSI black belt coaching means.
Man, it's unreal. I mean, so we just started Dr. Patel #2 on July 1st, and he feels like he's drowning in information. He's drinking out of the fire hose, man. He's used to a shot glass, and he's got a fire hose pointed at his face right now. And it starts at 7:35 when we walk through the door. It's how you carry yourself. It's how you show up to the job as a leader. It's how you show up as a role model. It's how you communicate with your team, how you encourage your team, how you train your team, how you keep your team accountable, and all these. At 8 o'clock, when the patients start coming through the door, it's how do you communicate with the patients? How do you connect with the patients? How do you understand what the patient wants? Because what we say here is we're going to be the best dentist you've ever had. You know how I know that? Because we're going to give you what you want, not what you need, right? So it's how to extract that information from a patient, what it is that they truly want. We call it asking for the answers to the test. If you give me the answers to the test, Paul, I'm going to make an A every time. So why the hell do dentists take tests on patients every day without asking for the answers? It's really easy. It's really easy. Just
I love that.
The power of communication. What do you want? How can I serve you best? What's most important to you? And if the patient says the most important thing to me is getting this single toothache out of my head, that's what they get, right? But through our communication, we can take a patient that comes in with a single tooth problem and help educate them how that single tooth problem can turn into an implant or a bridge or PRF with IV sedation, right? So we help educate them on their options, and we guide them to decisions that they're comfortable with instead of telling them what they need.
I love that. That's a masterclass communication. As we kind of unpack this a little more, people can text Shreveport to 215-798-9897 to learn more about this. You can go to dentistjobconnect.com. But what I like to do here, Ben, is to help you, because we all want to collapse time, a popular phrase through the DSI group. And when Jason Tenori was at our boost camp, he says that he sends his associates like frequently asked questions to the job with his office. And then he says, contact us if that sounds good to you through this. So I want to give you a mini version of this. So we'll do kind of a speed round of just questions. And if someone popped on right now, they would learn more about Ben. So even if we've been through this answer, just reinforce it. Where are you located?
Shreveport, Louisiana. We are 20 minutes from Texas, and we're about 30 minutes from Arkansas. So if you're in Shreveport, you can make it to Dallas in 2.5 hours. That's where my kids play soccer. If you're a mountain person, you can get down into southern Arkansas. There's some of the most beautiful mountains in the country. If you're a food person, you got Baton Rouge, Lafayette, New Orleans. Of course, we got football, Mardi Gras, and the great culture here in this state.
Awesome. I love that. Now, I know Simon Sinek, start with why. It's a popular thing, but just in your best few sentences, why are you looking for another associate dentist?
Man, because we're a thriving practice, and I'm the bottleneck to this practice, and I'm removing myself from that, and we're adding more providers. We're seeing 125, 150 new patients a month. We've built a facility big enough to always say yes to a patient. We have a 3-year-old 14 operatory facility with all the bells and whistles. We have 3 same-day crown machines, nice. IV sedation, CT, digital, everything. The list goes on and on and on. So at this point in the game, the thing that keeps us from saying yes to same-day dentistry on every patient that walks through the door is providers. So we need another dentist.
I love that. Now, this associate, everything's with them. What's in it for me? I teach my team that. I talk to them. So just talk about this associate. You're putting yourself in the scrubs of this associate dentist or the loops of this associate dentist. What are they going to be doing most of the time? I know there's opportunities to watch IV sedation. I know there might be opportunities for full mouth rehab, but if they want to make sure they're fit for you, what do they need to be skilled at to do most of the time, or at least interested in having you teach them?
Dude, It's back to the simple two things: coachability and culture fit. The thing about our practice now that we have myself and Dr. Patel, number one, that do all these super advanced and exotic procedures, as Mark Costas calls them, that means there's actually room for somebody that doesn't want to do all that. So, like, if you entered the practice and you're like, hey, look, I want to be your bread and butter dentist. This IV stuff scares me. These wisdom teeth scare me. These implants scare me. Like, great. You know what? Dr. Patel is going to be really happy to focus on these other things. Now, that's thing number one. Thing number two is we have an abundance mentality around here. So if you like, hey, I want to be your next $2 million associate, we've got the systems here to make that happen for you.
I love that. So it's an opportunities to do fundamental dentistry and then also grow. It sounds like your associate has done. Tell us a little bit about the schedule. Just like, hey, if I'm going to work with you, Dr. Ben, I'm into culture, into coachability. Just like, what's my schedule? Is it 5-6 days a week? Is it nights? Is it weekends? Just what's the general schedule like?
Yeah, dude. Our arts and crafts course here is 8 to 5 Monday through Thursday. We do limited Fridays. They are typically when one of our dentists comes to us and says, hey, look, this is a big case that I want to devote my full concentration to. I do not want to be doing hygiene checks. I would like you to schedule this on a Friday for me. So that's how we roll with Fridays. Or sometimes, like, if a dentist is focused on their production and they plan on taking 2 weeks off or a week off or something, and they want to pick up Fridays so that their monthly production doesn't drop, you've got that in your hip pocket, Paul.
Nice. I want to pause for 3 minutes, do something to honor my own dad in a fun way, because you said something that was interesting. So I grew up in my dad's dental practice, and he would say to me as a kid, checking hygiene is so hard. You have to break your concentration. You got to go into another room. This is timeless, right? It doesn't matter if it's the 80s, the 90s, the 2020s. You said something I'd just like to teach this community. It sounds like you do some big cases on Fridays when there's no hygiene checks, right? But you're Ben, the super GP of this. Why is that valuable to kind of put something you can focus on a Friday and not be distracted by hygiene checks?
Yeah, because, when you're trying to do an advanced procedure or you've promised a patient, 28 crowns in a sitting, man, you gotta have the pedal to the metal. You can't be distracted. You're doing a full arch. You don't need distractions. You can be focused on keep the main thing the main thing. And
yeah, Jalen Hurts, I like that. But thanks for not. I know he didn't invent that quote.
Paul, look, dude, I'm gonna have to quit using your services if you keep referencing Alabama players, dude. This is wrong.
Everybody likes him. Doesn't matter where he's come from. But I think that's just a fun thing to learn, because it's a tale as old as time. And I believe, I created a whole hygiene center where we have a location where we do most of our hygiene outside of drilling, because I said, it's such a distraction. Now, I'm not saying you can never do it if you're doing a simple crown or filling, but when you're doing high level work, it's hard to break your concentration. And that's just what my dad used to say that all the time. Really hard to break it. I appreciate you sharing that. So as we wrap up, Ben, anything else you'd like to share about this position? If you're talking to somebody who's happening on this video on our Job Connect site, on one of our social media channels, someone texting to, for them to say, hey, reach out to us. Let's do a Zoom interview. Let's talk on the phone. You might not have grown up thinking you're moving to Shreveport, but Dr. Patel's there living his best life. So I kind of leave the last minute for you to kind of inspire anybody listening. Yeah,
dude. I mean, I'm a salesman at heart, and I've sold this thing pretty hard over the past few minutes. But look, here's the deal. I'm going to tell you, there's a velvet rope on this, man. If you're not a hard worker, if you're not here to make it rain, then this isn't the job for you, because I'm going to show up every day as the best version of myself, and I'm going to expect that out of my team. So, look, if you just want to coast, I can tell you some other places to go coast. If you want to come be a cold-blooded killer and learn how to make it happen, I'm here. I got your back. And you really can't find a better opportunity in the United States of America to have a great dental practice. I mean, almost 2,400 5-star reviews. I did $2.5 million out of 4 operatories by myself back in the day. I can teach you how to communicate with patients, do high-level dentistry, and I've got the most badass team around, and that's a guarantee.
Awesome. I love that, Ben. Thanks for sharing with us. Stick around for a minute, and I'll appreciate all that you do for the Dentist Job Connect and Dental Nachos community.
All right, man. Thank you, Paul.